were immunized routinely,
Right.
but the immunity waned after about 20 years, so that even those that were immunized may not have an effective response against the disease. And the disease, we know there's two stocks of smallpox in the United States and in the former Soviet Union, but there is some suspicion that other countries or other agencies may have obtained smallpox, and that's why we have developed a national response plan towards smallpox.
And what is the nature of that response plan?
One of the first steps is vaccination of certain volunteer healthcare providers, so that we will have an able group of people with some good level of immunity to smallpox. For example, I volunteered, since I received the vaccine when I was born, I volunteered to receive the second dose of smallpox vaccine so that I can have sort of an assured level of immunity against it.
Now, how about booster shots for the general population? Is that viable, or are there too many side effects?
There's probably too many side effects. For example, people that are immunocompromised with cancer or HIV infection, if they come into close contact with somebody who's been recently immunized, they could catch the disease from that person. So it's not generally recommended. A huge risk-benefit analysis was produced and funded by the government here, and it basically said that vaccinating a small group of healthcare providers would be the safest approach and the most effective approach with the fewest side effects.
But that's not true, for instance, of the influenza virus. You're not susceptible to catching flu from somebody that's recently been vaccinated against influenza, are you?
No, you're not generally susceptible unless the outbreak of influenza was from a strain to which the vaccine did not protect you.
And Lydia, would you recommend everybody getting flu vaccinations, and are there additional benefits beyond flu of getting a flu in?
Currently, I think the general recommendation that I would go with, which is the World Health Organization and CDC recommendations, is that elderly people or people who are immune compromised, they usually generally vaccinate for influenza. The general public doesn't have to worry as much. There's a building sort of thinking that vaccination in general is not always the best thing to do. And I believe that influenza, the vaccination, although it's good, sometimes they don't target it exactly correctly. The healthy average individual survives an influenza attack. They also have medications now where they can help reduce the length of time.
But I've heard that it boosts your immune system in general against even things you may have not been inoculated against. To get an influenza shot, would it not be recommended to have one of those anyway for many people?
I think that vaccinations in general, they boost your immunity to that particular agent that you're vaccinated against. And it's not always such a good idea to have our immune systems activated against something we don't need them activated against.
Sure. And in fact, there's some theories that can actually cause allergies and such, to have too much immunization, that you want to be exposed in childhood to some, hopefully not lethal toxins.
There's a current debate on now, and I believe it's being studied in immunology, about how much we want to activate someone's immune system and whether or not that will result in chronic immune diseases. And I think that Dr. Asfour can respond to that as well.
Yeah, no, there's definitely a debate, not just with vaccinations, but with cleanliness. For example, too much cleanliness, wiping out too many bacteria, and not exposing young children, to different bacteria and different organisms would result in their immune system activating against itself.
So the old admonition that it's okay to let your child eat a pound of dirt before they're 2 might not be all bad, huh?
Might not be.
Well, fascinating stuff, and I'm sure we'll have some more topics to explore here during other parts of our show. So again, thanks so much for those wonderful answers from our two guests, Lydia and Dr. Asfour. Very wonderful of you to be with us today.
Thank you.
Thank you.
We will begin shortly with our second question and answer session, but first I wanted to ask a couple of questions of our fourth health communication specialist, Rick Strobridge, who specializes in the use of the latest technologies to improve healthcare and healthcare communication. Rick, our interviewees talked about the need for collaboration between healthcare facilities, especially in times of crisis for high-risk environment. What do you feel would be required to create a major interactive network that links the strategic health centers in the United States in other countries?
Well, that's a very interesting question, Fred, because I think the network infrastructure actually already exists, and that's the Internet. I think what we need to do is we need to use communication networks that are there and available. I've spent my career, in fact, just over the last few years, we've put together a network of 300 hospitals and a couple thousand operating rooms so that surgical training could take place between those different facilities. And that network uses fairly expensive high-speed communications lines. My current thinking is that we really need to focus on ubiquity and not necessarily high performance. And so interactive collaboration capabilities, I mean, there are systems out there now that can use web cameras, can collaborate over medical imagery, to a certain extent video, such as angiograms and things like that, and also audio. And so I think that ubiquity, using the Internet, and then simplicity of use is really key.
All right, well, great. Well, so telemedicine has expanded with growing telecommunications capabilities. Is this modality suited for use in high-risk environments or during times of crisis, and can systems such as room video conferencing units be designed to minimize these impacts in a cost-effective way?
Well, I don't know about room video conferencing units per se, but some modification or some customization of those room units, I think, is definitely applicable to what we're trying to do here. Children's Hospital of Los Angeles, for instance, has the premier pediatric trauma facility in Los Angeles County. They get sick and injured children, high-risk cases, from all of the outlying hospitals. We just finished putting together a network for them that takes 5 of those regional hospitals that are typically, when an injured child comes in, the adult surgeon says, what can I do with this child? They don't know how to deal with it, so what they do is they put the child on a helicopter and fly him to L.A.
Interesting.
And so what we do now is we use a video conferencing capability to let them do the triage and start some of the treatment and maybe keep them in that outlying hospital.
Good. Very good. Thanks. Interesting. We will now continue with the second question and answer session, and our question comes from Chihuahua, Mexico. Go ahead, please.
Yes, do you consider that in the near future we can implement other health initiatives that do not go against, for example, human rights?
Okay, health initiatives that are not against human rights.
Well, of course, human rights is an extremely important issue, and every culture and religious group defines what are human rights a little differently. Some cultures have objections to immunization, some have objections to birth control, and you always have to work with the indigenous group to make sure that whatever interventions you're trying are compatible with local customs. When you're diffusing any innovation, particularly health innovation, critical is compatibility and simplicity. People have to do something that's simple that they can do, and it has to be compatible with their pre-existing values, and it has to respect their rights.
Okay, we go back to Puebla for our next question. Go ahead, please.
Buenos días. Good morning. I'm calling from the Ministry of Public Education from the state of Puebla. My question is the following. Would you recommend vaccinating children against the flu, and if so, at what age?
I think that
Yo pienso
that in this day and age, in this country, we vaccinated people for flu that we didn't normally vaccinate this year because of the SARS epidemic. We really wanted to make sure that people did not get the flu, as if we had another SARS outbreak that might spread even further, it would really confuse. We don't know who has SARS and who has the flu. But until this year, we didn't really routinely vaccinate children in the United States. And each regional authority makes its own decisions here at the CDC on whether or not we should vaccinate children in a particular year.
Thank you. Our next question is from Veracruz, Mexico. Go ahead, please.
From an ethical standpoint, what should be the role of the media in terms of health?
Well, media are essential because they're so ubiquitous in the world, and because they use public airwaves in whatever country they're in. I believe they have an obligation to provide for programming and commercial advertising to enhance health practices and to inform listeners on prevention, health prevention.
Thank you. Sabinas, Mexico, would you go ahead, please, with your question?
My question has to do with what actions do you recommend for that business people don't doubt in investing in a culture, a health culture with its employees? What do you recommend?
One of the most impressive examples of business people investing in their health of their people is in South Africa, where a lot of the companies, big companies, have been providing drugs to treat people with HIV. They've been providing free health care for their mining workers, gold workers. So companies have started to realize that the health of their employees is really a major factor in determining the success of the company overall. And as well as that's why most companies in this country, for example, offer health insurance to their employees because it is in their long-term benefit.
Thank you. We go back to Veracruz, Mexico for our next question.
Oh, I'm calling from the Technological Institute of Tierra Blanca. I would like to, I'm sorry, we didn't hear the question. Perdón. What are the symptoms of anthrax, if you could please explain?
Yeah, the symptoms of anthrax initially can just be flu-like illness, which confuses a lot of people. They can also have sore throat and lymph nodes that might be swollen. That's in inhalational anthrax, where we usually think of what we usually think of in a bioterrorism outbreak. And those symptoms are indistinguishable at first. And one of the earliest signs is that the patient is really sick, and you do the physician does a chest X-ray, and the chest X-ray shows something called the widened mediastinum, which basically means that which hints at anthrax. Also, cultures of the microbes that the person might be coughing up would reveal that this is indeed anthrax. A heightened level of awareness needs to be in the doctor's mind when dealing with these cases, as anthrax can easily be confused for anything else early on.
Thank you for your excellent questions. Excuse me, but we have run out of time. We hope that you have enjoyed participating once again in this exciting multilingual and multinational program. We invite you to participate in the 4th video conference of the 2004 series airing May 13, 2004, entitled Networked Organizations in a Multi-Technology Environment, Optimizing its Resources and Virtual Teams. For additional information on this video conference series, please consult your participants manual, where you will find the dates and specific topics for each program. We also invite you to visit the ITC and the ITC GlobalNet websites. On behalf of all of us, I thank you for your ongoing participation and interest in this program. Thank you, and see you soon.